are new blood markers helping monitor bone cancer progress. Imagine having a way to check how bone cancer is doing without needing painful biopsies or scans. That's what new blood markers are starting to do for some types of bone cancer. While traditional methods like X-rays, CT scans, and biopsies are still essential for diagnosis, monitoring the disease often requires ongoing assessment of how it's changing over time. For cancers like multiple myeloma, which affects the bone marrow, recent advances in blood testing are making this easier and less invasive. Multiple myeloma is a type of blood cancer that can cause bone damage and weakness. Because it involves the marrow inside bones, doctors usually track it by measuring specific proteins in the blood and urine, like monoclonal proteins or light chains. These blood markers help determine if the disease is active, responding to treatment, or relapsing. Newer techniques, such as single-cell sequencing, analyze circulating tumor cells in the blood, giving detailed information about genetic changes in the cancer. This method can detect tiny amounts of cancer cells that might be missed by other tests, helping doctors catch signs of relapse early. Another promising development is the blood flow test, which looks for residual disease in the blood. It can find small numbers of cancer cells that remains after treatment, even when other tests show no signs of disease. This is important because it helps identify patients who might need more therapy before the cancer fully returns. These blood markers are especially useful because they are less invasive than repeated bone marrow biopsies, which can be uncomfortable and painful. While these blood markers are mainly used for multiple myeloma, they show how blood tests are evolving to help monitor cancer more precisely. For other types of bone cancer like osteosarcoma or Ewing sarcoma, imaging remains the main tool for tracking progress. However, ongoing research aims to develop similar blood-based tests for these cancers in the future. In summary, new blood markers are already helping monitor certain bone cancers, especially multiple myeloma, by providing less invasive, more sensitive ways to track disease activity. These advances give hope for earlier detection of relapse and more personalized treatment plans. But it's important to remember that each person's situation is unique, and medical decisions should always be made in consultation with healthcare professionals. These innovations are promising steps toward better, more comfortable cancer care for many patients.